Good morning. As always, we're going to start by thanking Jay Gates for being here to interpret for those that are hearing impaired in our community. Thank you, Jay, and good Monday morning to you. I'm going to go through the numbers as we always do. Those who have tested positive in Hamilton County, that number is 718. Those who have been hospitalized is 167. And we have lost 33 people in Hamilton County to COVID-19. The deltas there from Friday until today for those positive is 103, hospitalized is 20, and the death count over the weekend was 4. We do have the number of individuals that have recovered, and that number is 134. So as you may have heard, there's work going on by Governor DeWine to slowly lift restrictions in the state. While this is good news, we can't be lulled into a false sense of security. Our neighbors are still contracting the virus, they are still being hospitalized, and tragically, they continue to succumb to this terrible disease. So what does that mean? It means we need to stay home, we must continue to wash our hands frequently, and before we consider going out, we need always to ask ourselves, is it worth the risk to ourselves and others? So we're getting there, but we're not there yet. And I, as always, want to thank everyone in the community for doing what you need to do, doing your part to make sure that this community stays as safe as possible. We're doing pretty well in Hamilton County. It's all relative. I mean, we've lost people. And that's tragic, but comparatively, we're doing okay, and we've stepped up to the challenge. I want to talk very quickly about what's happening at the federal level. So all weekend, we were in contact with our federal delegation about federal legislation that is rolling through right now. They were working on it over the weekend. I expect a vote will happen within the next couple of days. And that vote is related to federal funding for COVID response. If you'll remember, we did get some dollars to Hamilton County because our population is over 500,000, but that money is very restricted and can be only used for very specific things related to COVID response. So it cannot be used for any of the revenue reductions that we are seeing and some of the things that we have had to do internally by way of furloughs and restricted funds and those kinds of things. The other thing we were hoping to do with those dollars is sub-grant out to some of our local jurisdictions because they too are responding to COVID-19, whether it's the city of Cincinnati or Deer Park or Gulf Manor or Green Township. We all have challenges and expenses related to COVID-19. And so we were hoping, and we still are hoping, that we can get some flexibility with those dollars so that we can help internally, but also help as we look around throughout Hamilton County to see where those needs are. So it's a work in progress. We were lobbying like crazy over the weekend, asking our delegation to pay attention to this. They're all aware, of course, of what's happening. And so we got a number of county officials to make those calls, to send text messages, to the point where I think the federal delegation was like, all right, we get it. But you know, we're just trying to make sure that we get some flexibility with those dollars that are coming our way, or new dollars, but either or, we just need some flexibility. So also, the numbers are starting to roll in related to what the county is doing internally, whether it's the courts or the prosecutor or the clerk of courts or the recorder's office. We're starting to see those strategies. Remember, each of the strategies are individualized to that department, whether it's an internal department under the board or it's a department that's led by an elected official. We're starting to see those strategies and those numbers roll in. I will have more on that on Wednesday. I will have literally a printout with what has happened so far and also the interplay with what's happening at the federal level. So more to come on both of those fronts. So we've got a couple speakers today. It's Tom and Tom, not yet. hold on. And I'm very excited to have these guys here because they are experts in the field when it comes to addiction and law enforcement and how those two things relate to one another. But before we get to Tom and Tom, I wanted to start with not a good news story, but a great news story. Hamilton County resident Emily Erdman didn't want all the uncertainty around COVID-19 to push off her boy's adoption date. She was ready to become their forever mom and didn't want a delay. So she and the boys finalized their adoption virtually via Zoom with probate court judge Ralph Winkler. The court has finalized adoptions via Skype a few times, including when an adoptive family lived in Hawaii and when adoptive families include a military person who was deployed. But this was the first for Judge Winkler and the first in the time of coronavirus. And you've got a photo of the boys up on the screen. Very, very adorable. So Emily was concerned about a long delay for the adoption. She said, "I just didn't know how long it might be before the court would open again." She is now home on adoption leave from her job as an occupational therapy assistant. So they offered this option, she said. "It's a good opportunity for me to be home with my kids and keep us all safe." Kez and Jahim, who are on your screen, officially became Erdmans last Tuesday. Kez will be 6 in May. He's in kindergarten and loved his first try at playing on a basketball team this winter. Jahim's birthday is also coming soon, and he'll be 4 later on this month. It's sometimes difficult to imagine life beyond the virus, but a story like this renews our hope and shows that we are not stuck in time, that life continues. And sometimes life's most precious moments come during the most challenging times. We wish the very best for the Erdmans as they come together as a family. All right, so I just wanted to share a great news story this morning. So with that, we're going to move on to our speakers. Today we're going to hear from Newtown Police Chief Tom Synan, who also serves as the interdiction chair of the Hamilton County Addiction Response Coalition. Tom will be discussing the illegal drug supply and overdoses in our community. We're also going to hear from Commander Tom Fallon, who leads the county's heroin task force and our quick response team. He will discuss how the quick response team is responding and adapting to work during the shutdown. So without further ado, Tom Synan.
Good morning. We want those with substance use disorder and families who worry about a loved one's addiction to know you have not been forgotten. You are on the forefront of the minds of individuals, agencies, the coalition, and the community during this unprecedented and uncertain time of COVID-19. Every day we are discussing, planning, and implementing how we can stay ahead of the hurdles and get life-saving supplies as well as access to treatment for those in need. COVID-19 has made many adjust procedures, but it's important to let you know that treatment has not shut down. You can still get treatment, access to assessments, and longer-term care is still available. Treatment has adjusted to ensure the safety of those coming in as well as those giving care. Be assured that you can get the treatment that you need to begin the life of active recovery. A list of treatments such as Talbot House, CAT, Brightview, Sunrise, Umadop, as well as many more, both in our area in Northern Kentucky, are open and ready to help. Addictive Services Council can connect you to a treatment center in our area, and their phone number is 513-281-7880. A list of resources is posted on the Addiction Response Coalition website. As well, we'll be putting together flyers and putting those out into the community with a list of resources that people can pick up. We are encouraging people to have Narcan on hand. We're closely monitoring drug supply trends. And as other countries that we know contribute to the drug supply begin to recover from COVID-19, we are preparing for the potential influx of fentanyl. We know that fentanyl is still in the streets, but we want to be prepared in case there is that potential influx from those countries coming into the drug supply. Those in need to be aware that your tolerances may be down, and what you think is a safe amount may not be. Those that use other drugs could also see an increase in that fentanyl in their drug supply and should have test strips as well as Narcan on hand. Narcan is still available. If you are in need of Narcan, call the Hamilton County Health Department at 513-946-7676 or email them at narcan@hamilton-co.org. Hamilton County Health is still providing exchange services by appointment, and you can call them at 513-316-7725. Harm Reduction Ohio also will mail Narcan directly to your house. Outreach groups such as Caracol will deliver needed resources, and they can be reached by phone or text at 513-357-7642. We are aware of the need to ensure treatment and recovery has the resources they need both today and when we come out of this, to make sure our systems not only come back to levels before, but that they're stronger and more efficient. If there was a question of the benefit of harm reduction techniques, COVID-19 teaches us that without harm reduction, our systems dealing with a pandemic would be even more overwhelmed with higher rates of overdose, immediate health issues, and deaths. There is no higher priority than ensuring our fellow citizens, including those with substance use disorder and mental health conditions, have the ability and opportunity to achieve active recovery. The unity of the coalition, collaboration of partners, and the determination of a community ensure we will not have to start over. It shows our strength in connections and that we will be able to rebound faster. Even in these times of COVID-19, when we might be physically apart, the strength of our partnerships show there is a constant we can always rely on. Treatment is staying open. Outreach groups are finding ways to provide assistance. First responders, nurses, and doctors continue to provide service to those with addiction. It all validates that addiction is a chronic mental medical health condition, and those who struggle are worthy of the chance to have a healthy life. Thank you to everyone who has given contributions to addictive services, food pantries, and the homeless. We ask that if you're able to continue those contributions, especially as demand increases. Thank you to all the first responders, nurses, and doctors who are on the front lines saving lives. We also want to recognize the treatment workers and peer mentors. We always knew how essential you are, but more than ever, you have stepped up, sacrificed, dedicated yourselves for the well-being of others. You are our heroes. By being in this together, working together, checking on one another, we help to ensure all of us, as a community, can come out of this with lives saved and addiction resources stronger than ever. We are with you, we are in this together, and with each other, we will recover. Thank you.
To thank the Commissioner, thank you for your leadership on the COVID-19 crisis. It's very important. First, I'm going to address two areas, the Heroin Task Force and the Hamilton County Quick Response Team. As you know, the Heroin Task Force was established in 2015 with a mission to investigate overdose and overdose deaths back to the supplier. We've had to change up a little bit during this current crisis, but luckily we have a great relationship with Dr. Samarco and her staff at the coroner's office and their investigators specifically. They're collecting the evidence at the scene. Our investigators are meeting with them and beginning the investigation there. So it's a little different, but we're still seeing some effectiveness. I wanted to cover some of the overdose death numbers or suspected overdose death numbers. In March of 2020, there were 35 suspected overdose deaths. And as I was talking to the administrator at the coroner's office, the same number last year in March of 2019 was 39, and then 35 back in 2018. So we're kind of seeing a steady number of suspected overdose deaths, and we're also seeing this month, I think they're at about 15 through Friday. So we're not seeing a decrease. It's pretty much steady. Talking about the drug supply, it's readily available, and it's still fentanyl in Hamilton County is what we're seeing a lot of. Then next, I'm going to move on to the quick response team. Hamilton County, I was just telling the commissioner that 2 years, a couple of days ago, that we started the quick response team. The quick response team's whole mission is to connect people that have overdosed to treatment. Like other QRT teams in the state of Ohio, we've suspended field work, which is kind of common. Initially, during the COVID crisis, we saw a steep decrease. I'll give you some numbers, and then it went back up to somewhat normal, and these are based on hospital visits. March 5th through the 11th, there was 30 hospital visits for that week in Hamilton County, and then that next week it went down to 12. And then basically since then, we've seen numbers in the range of 20 to 30 per week. So what's the Hamilton County Quick Response Team doing? They're still doing active outreach. That outreach is being utilized via social media, phone, and family contact. Our peer recovery folks and our addiction team members are doing a lot of regional networking to try to find other ideas and ways to reach people that have overdosed. That's the hardest part in QRT, is finding people to connect them to treatment. We're still seeing daily successes in the connecting people to treatment. It happens every day. With that population, we're seeing excellent access to treatment that Chief Sinan talked about. There's plenty of room at the engagement center, at other residential treatments, at plenty of outpatient medically assisted treatment places. So we're seeing a lot of positives. It's just a little bit different. One loss that I felt like I must address was, the biggest part of QRT is that rapport and relationship building. When you make that knock on the door and you talk to those people, we've lost that cornerstone. A lot of times people want help, but they may not want it for 2 weeks or 3 weeks later. So we've lost that relationship and that rapport building. I will tell you, on both fronts, for the QRT and the Heroin Task Force, I am currently working with the Hamilton County Police Chiefs on how we're going to get back in the field, and our people are chomping at the bit to get back out in the field and to do the work. Thank you.
So thank you. The work has always been important in this community. It continues to be important. We've got some challenges because of the lack of interaction face-to-face with those that are in recovery and those that want to get into recovery. However, treatment is still available, and I know the providers are doing the best they can to meet people where they are and try to provide the best treatment that they can. Anecdotally, I heard a story as I was driving in this morning on NPR about this very issue, so I know it's top of mind. So thanks to the two of you for doing what you're doing, and the Addiction Response Coalition continues to do the work. We're actually virtually meeting every week because of what we are seeing on the ground, so the work continues. So thanks again to both of you. So with that, Bridget, I think we will open to questions.
Our first question comes from Chris Wederick with the Cincinnati Business Courier for you, Commissioner.
Okay.
Hey, good morning, Denise. I wanted to see what you thought about this reopening idea. Are Cincinnati and Hamilton County, are they ready to reopen? I got 3 questions actually today. And if so, what do you think are the first things that can open back up?
Well, as we have done throughout this entire pandemic crisis, we're following the lead of the state public health officials in addition to the county public health officials, because they are working in tandem. And so I know that people are anxious to reopen. I too am anxious to reopen. However, we heard from some of our folks that are involved with the business community that while some of them could weather this once, they do not want to have to try to weather this twice. And so my concern is that we ramp up too quickly by way of these openings. I know we all want to do this, and I think there's a strategic and smart way to do that, and I think we've heard Governor DeWine actually say that. And so we will follow the lead of the governor and public health officials as to how we open up and how quickly we open up.
Do you think we have enough testing capacity in Hamilton County to quickly, come down on any outbreaks should we start to reopen?
We need more testing capacity in Hamilton County. I mean, we have not had enough people tested, which skews those numbers a bit, as you know. And so, yeah, I mean, I think testing capacity is it's one of the elements that needs to be in place before we go to a full-scale reopening. And things are going to change as people go back to work, as they go out in public, by way of social distancing, wearing masks. So all of that needs to be contemplated.
And then lastly, there was an item in Politico a few days ago that said that, and this goes to the aid that you are hoping to get from the federal government, it said basically that the Trump administration was holding back on signing off on Congress providing that aid so that it could have leverage over the states in order to determine when they reopen, basically. I wanted to get your reaction to that.
Well, I will tell you this. We have been asking for weeks now for some flexibility on these dollars. Now remember, it's Chris, so some of us got those dollars, they're highly restricted, but remember, it's like $143 million. Now, that has to be spent on COVID response, which is very limiting, and we've looked at the language. And so the worst thing would be that we had that kind of relief and we weren't able to use it out in the community and internally for what we are seeing play out here. So that continues to be a frustration, but what we're advocating for is some either flexibility in those dollars. So that's Hamilton County, but then there are all these cities and smaller jurisdictions that did not get that money. Because of the population restriction. And so they are asking for some additional dollars because they're all getting whacked because of income tax or sales tax or fees. And, we all have reduced revenue right now. And so I'm going to be hopeful until I shouldn't be, because we've been talking with Representative Shabbat, Representative Wenstrup, Senators Brown, Senators Portman, and as I said, it's not just me. We've got people out in the outlying jurisdictions calling these representatives. We've got, I think Rob Gehring, Joe Dieters, Bill Seitz. We've kind of enlisted our friends and the folks that are on the ground during this crisis to drive home the idea that we really need this relief. Because we've got some serious reductions coming, and we're trying to stave off, right? And we've got things playing out internally where we are reducing the amount of money we're spending right now. But I tell you what, if we could just get some flexibility in this language, then we would be able to go a long way when we reopen to say, all right, we're on solid ground right now, and spread that around a little bit. We're just not there yet.
Thank you.
Our next question comes from Scott Wortman with the Inquirer for you,
Scott.
Commissioner.
Good morning. I am getting caught up. I'm just getting back off of furlough. So some of these questions are a bit redundant, but as far as budget cuts, what resistance are you getting from department heads? Do you anticipate any conflict, like either the prosecutor or a coroner and getting agreeing to enough cuts to meet the shortfalls?
We, to my knowledge, are not getting any resistance from any of the elected officials. In fact, they are laying out their plans to get to reductions. And so I will provide more detail on Wednesday. We have started, all that information is starting to roll in through the administrator and we have budget analysts that are reaching out to each of these departments as they do year-round as we formulate our budgets. And so that information's rolling in. I suspect that every department will have something, whether it's use of restricted funds or furloughs or whatever it is, they are all trying to be part of the solution here, and that's my understanding from the county administrator.
When will the decision actually be made by the county commission, to actually make the cut?
Well, they're being made right now. And so, I mean, part of my staff, I have 2 staff members, one of them is furloughed as of today. We're taking a 10% pay cut as of today. So all of these things are happening as we speak, and some of the departments they've already started to furlough their people. So let me get the dates of all that rolling out, but I've got some information. I just want to make sure I have everything I need to talk to you about this intelligently. And so on Wednesday, I'll have that from the administrator, and we'll kind of lay it all out. And department by department, I will be able to tell you what's happening.
Thanks, Denise.
Jay Hanselman with WVXU has a question for you, Commissioner.
Hey, Jay.
Hey, Jay, we got you on mute.
How about now?
Here we go.
Thanks, Commissioner. The first is more maybe a request. I know each morning when you do the briefings, you give the hospitalizations, which I believe is a cumulative total. Perhaps on Wednesday, could you give us a snapshot of how many people are actually hospitalized at that particular time rather than the cumulative total?
I can try to get that together. Remember, on Wednesday, Greg Kesterman's going to be here. So he's the public health commissioner. And so I'm really looking forward to having Greg in. We try to get him in once a week. And I expect he's going to give us an overview. We're going to try to put a graph together so that we talk a lot about this curve and flattening the curve. So I'm hopeful that we'll have hospitalizations, positive cases, hospitalizations, and then the death curves so that you can visualize what we're talking about. And then we're going to do a pop Q&A with the health commissioner, because I know you guys have questions, and I want to make sure that when we get him in here, we're hitting it on all fronts. So Greg will be able to answer those questions, and I'll make sure he's got that information.
And then just to follow up again on the $143 million of federal money, is there language in there that concerns you that you may not be able to share that with outlying jurisdictions? I know you say you're hopeful, but is there something in there that bothers you that you cannot do that?
I'm bothered that we don't have clear direction right now, I'll tell you that. So yeah, I think there's some concern, because what we would like to do is it would be like a sub-grant to the 49 jurisdictions in Hamilton County to say, if Hamilton County is the one getting the money and they are not, I would like to have the ability to sub-grant to them as it relates to what they've spent during this crisis. I don't know if we can help in every case, but because it's restricted money. But I'd like to have the capacity to do that. So the administrator and I have been talking to our federal lobbyists, to folks that are familiar with the language coming out of Treasury, and because the last thing we want to do is, allow for that money to go out and then have it not qualify. We can't do that. And so we need to get a firm understanding of what we're allowed to do. So I've talked to John Cranley about this, the mayor of Cincinnati. Of course, they are suffering, as is everybody else. I'm on these jurisdiction calls twice a week, and we're hearing that they're spending money in response to this, and we want to try to help if we can. So yeah, I think there's a little trepidation still at this moment in time, but I think once Congress takes their action, I think it's going to be within the next couple of days, I think we will get the clarity that we need one way or the other. I, again, am optimistic that we'll have some flexibility there, but at least we will know how we can spend those dollars.
Thank you.
David Winter from Local 12 is up next for you, Commissioner.
Hey, David.
Hi, can you hear me, Denise?
I can.
Oh, great. So staying with this grant money, I know you're looking for clarification, but you already determined that you were able to spend, I believe it was $500,000 on homeless issues. So clearly there are things that you know you can't spend this money on. Can you give me some examples, or give us some examples of things that you can spend that money on, and when are you planning on making decisions if you know you can spend the money on certain things?
All right, so what we know we can spend the money on is COVID response. And so it's any money that we are spending right now that was not in this year's budget. I'm going to say that again for you, because anything that was in the budget that we passed is not eligible. Okay? So that means anything that's new in response to COVID-19. So think about the homeless money that you just talked about. So it's upwards of like 1.1 million to rehouse those individuals. That money is eligible. The money that we're spending on PPE, the protective equipment, we have at EMA, the Emergency Management Agency, they are the ones that are bringing the resources in by way of PPE and distributing it out. And they're working with the Health Collaborative, so those PPE, the masks, the gowns, the gloves are going to hospitals, they're going out to first responders, they're going out to nursing homes, they're going out to JFS for the folks that are still in the field, making sure kids are safe in this community. So we have spent, I think it's upwards of $1 million on PPE, because we are going through our purchasing department to wherever we see a supply to buy that equipment. And beyond that, we can use it for this, and if we have some left over, good for us, right? Because then we'll have it stored up for the next time we need it. So those are a couple of examples of what we know we can spend on, but as you can tell, 143 million, and we spent about 4 or 5 million right now. It's just frustrating. And so we are trying to do what we can in that space, but also get some flexibility, again, so we can help in other spaces.
So I realized that you had said $1 million on PPE and $500,000 on the homeless resettlement. You just said that there's another 4 or 5 million that you have spent of the 143 million. Can you give some more examples of other places where there's a delta there of $2.5 million?
Some of it is also redeploying some of our employees. So in our department, we have Robert Bell, who does our economic inclusion work. He's being redeployed to, I believe it's public health, to help make sure that we are engaging the African American community by way of our messaging and our outreach during the pandemic. So that salary cost associated with him being redeployed, that'll be picked up through that money. That's another example.
And is that, do you have another one or two? There's a
about
lot.
it.
There's two and a half. Well, it's $2.5 million in delta there.
The only one. There are other people being redeployed from other departments. If we've got folks that can work, and you know what the other one is 911. It's the equipment. Remember, we talked about how 911 in their workplace, as they are, sit very close to one another as they're receiving calls. And so we were in a position to buy some additional equipment for 911 so that we could take like half of that staff off-site, whether it's individually at home or in a different facility, and I think it's a little bit of both, but they needed the equipment to be able to do that. And so we were able to purchase the equipment. It was kind of already in the works because we needed more equipment anyway, but we got enough to take some of that staff, and I think this was a couple million, to get that equipment, to get them off-site so they could continue to answer the phone. We still have enough people responding to those 911 calls, but they're not all sitting on top of one another. So that two, plus the other, one for homeless, the other for PPE. We've got some other through redeployment that gets you to about 4 to 5 million.
Yeah, that's great. And Denise, thank you so much for being so specific. I really appreciate it. One last question. I apologize, guys. And is, I remember, and I should know the answer to this, so again, I apologize for asking the question, but I remember that when that $500,000 was being allocated or suggested by you for the homeless, you said that we needed to still vote on that. Was that voted on? Was that approved? And do these other expenditures need to be voted on and approved?
So 911 was already voted on and approved. Homeless was voted on and approved. The redeployment, we've already taken care of. The PPE, we've approved all this stuff. So
Great.
yeah, we are meeting once a week still, albeit virtually, but we're meeting once a week to make sure we're getting this work done.
Okay, thanks again, Denise. I appreciate your candor.
That appears to conclude the questions from our reporters.
Well, Tom and Tom, I mean, we've got the experts in the room here. So, all right, well, very good. So, and I've already mentioned it, we're going to have Greg Kesterman, the health commissioner, with us on Wednesday. You know, Greg is 24/7 doing this work. I mean, he's in constant contact with the folks at the state level, and so we will welcome him. We're going to do a little bit of a pepper Q&A with Greg. Of course, the press will have the opportunity to do that. I'm going to do a little bit of that myself as things come up, because Greg is such a wealth of information and knowledge, and I don't want to miss the opportunity to allow him to talk about everything related to this crisis. So thanks to him for being willing to come in. Thanks to Tom Fallon and Tom Sinan for being here. They are on the ground doing the important work for people that suffer addiction, mental health issues, still trying to get it done on the ground. So thanks to both of you for being here, and we will see you on Wednesday. Thank you.